My name is Kareem Bebe. I am the founder and CEO of HealthSapiens. HealthSapiens provide unlimited access to doctors nationwide. We serve patients across 50 states and the state of Puerto Rico. We are an existing business. We have 1,000 doctors in our network. We are here when nobody else is there. We are actually reimagining healthcare. So why don't you take a peek at what we do and how we are changing healthcare. We are collapsing the barrier between providers of care and seekers of care. We are here when nobody else is there. Healthcare is imposed upon each citizen. So you either have to be within a geographic location, belong to a system of a sort, be a citizen of a country to be able to have access to care. But even if you do have access to care, you have no clear understanding of the nature and the pricing of the procedure. If this trend continues, it's simply not sustainable. HealthSapiens allows you to compare and contrast various providers from around the world and be able to have an educated decision based on outcomes that have been verified within the blockchain and are immutable. Our token allows you to directly seek care from your provider of choice, whatever that provider is, regardless of their geographic location or any boundaries that has been imposed by a central authority. And where all actors are properly incentivized and rewarded is the fundamental basis of why HealthSapiens 2.0 will be the solution to the global crisis in healthcare. So we all know that healthcare is a tremendous industry. It's estimated at $3.2 trillion in the US, estimated to reach $8.5 trillion around the globe. The healthcare, in essence, is broken, whether you are on the government's dime or you pay for your own health insurance. It's, it's tremendously expensive, and having an insurance doesn't necessarily mean that you have access to care. So the four major problems that we're tackling in healthcare is there's no access to care. There's a lack of access to care. We all know about it. High quality and high cost of care, coupled with the low quality of care, and there's way too many intermediaries between the patients and the doctors. So the market size that we address is close to $40 billion. We're happy to get even a small fraction of that. So the solution that we are proposing is a tokenized ecosystem that is built on an ERC-20 that incentivizes patients to connect with doctors and vice versa. And we are creating the equivalent of a FICO score for a healthcare, whereby providers are rated by other providers and you can have access to them. So in essence, we're creating a market for healthcare that doesn't exist. Healthcare is the only industry, ladies and gentlemen, that you only discover the price of the procedures after the fact. It's ridiculous. So the solution, we are providing better access to care, fair pricing, minimize third-party interference, i.e. insurance brokers, government, that are not properly aligned with us, patients, or with doctors. This is the first time in the history of America where actually doctors are decentralizing their kids not to become doctor because it's not worth it. So that's a big issue that we're facing. The high quality of care, which is lacking because there's no market of care, for healthcare, and we're creating that. So why now? Well, 20 to 40% of healthcare spending goes in two ways. Goes into bureaucracy and necessary brokerage. We have an existing business, and I can tell you the various intermediation that you need to go to as a carrier to reach the consumer or the patients. Excessive intermediations, and quite frankly, there's lack of accountability. It is fee for service as opposed to fee outcome. Today you go and see a doctor, he spends 7 minutes with you, and he sends you home, or he can write you a script and you're on your own. There is no accountability, there is no recourse, there is no self-correcting mechanism, and this has to change, and we are changing it. So the team, obviously, I've been in healthcare for the last 5 years. I'm originally a banker and an investor. So I've been investing in other LPs' money as well, our money, for the last 15 years. The whole team, we've been working together for close to 5 to 10 years, depending on who you the advisory team on this page, it's who's who. These are household names in the healthcare space. The chief cardiologist at Mount Sinai in New York. Fred Brown is the chief medical officer of Griffin Hospitals in Connecticut, to name just a few. So why us? Why HealthSapiens versus others? One, because we have a track record of creating a disintermediation between patients and doctor. We are an existing business. We have a 5-year track record. We're providing unlimited access to doctors for just $14.95 across 50 states and Puerto Rico. We have 22,000 members, and we have 1,000 doctors in our network. So competitive advantage, we have filed a claim. We have filed a patent for 17 claims back in May. So I think that's to stake our ground and not to allow anybody to take away some of the idea that we're bringing into the market. The business model, so we making money across 3 platforms: transactional commission, connecting patients and doctors; 2, by bringing the EMR to the patients, and we let you as a patient own your electronic medical record and be able to monetize it at a market clearing price. And as I mentioned, we're creating an index for doctors that will allow doctors to obviously seek out various pricing for their procedure. The ask, we have self-funded the business. So far, we are in the pre-sale, which is going to start in September. We're looking to raise $5 million, and then we're going to be issuing a security token for $25 million at the fourth quarter of 2018. And this is me talking about blockchain at the United Nations General Assembly in May of 2018. So this is my contact details, and I think I see Brett said that I still have 3 minutes, so I think I zooped through it. So I'm going to open up for questions for our audience. So the business model, we provide you unlimited access to doctors. So the token that you'll be buying will provide you with 3 things. It's a medium of exchange to seek care from providers from around the world, to have immutability of your electronic medical record that is sitting across 55 siloed healthcare systems around the world. So nowadays you have no access to your electronic medical record, so you'll be able to hash your electronic medical record across all systems and provide access to the providers of choice. And 3, it provides doctors to expand their network above and beyond of just seeing the patients that are dictated by the insurance or by Medicare. It's both. The HealthSapiens 1.0 is actually a telemedicine. The HealthSapiens 2.0 is both. It's a virtual as well as face-to-face consultations. I give you an example. For instance, I brought my mom in 2007 to have a cataract surgery from Paris. It cost $15,000 for one eye. The second eye, she went back to Paris. It cost $2,000. And she swears that the outcome of the second eye is better. So there's a clear arbitrage in the healthcare market. So what we do, and we do what Upwork has done for engineering consultation. So we bring in all providers from around the world into a healthcare where they can compete and on a fair level. Did I answer your question?
I mean, I don't go after the arbitrage of healthcare costs between US overseas, or
it's not. You both. You have the choice to first consult with a doctor via any medium of exchange that you have. It could be a telemedicine, but you can also see them in person. That's just part of the equation. We're not here to kind of close the gap between arbitrage, but what we're creating an opportunity for patients to interact with doctors regardless of geographic location or regardless of whether you have an insurance or not. Because if you have an insurance, by the way, you're bound by the network that the insurance has created for you. So we're just breaking this up. So you can still use your network if you would like to, but you can also go somewhere else because nobody has monopoly on medicine. Plus the premium that you pay on insurance, you lose it every year, so you're not accruing it. For us, if you buy the token and if you're not using it, it's still yours. It doesn't disappear. Any other question?
I think that's your time. So thank you so much. Let's get a big round of applause.
Thank you.
Thank you, Karim.